The following program is a Town of Colonie television production of the William K. Sanford Town Library.
Hello everyone, and welcome to Health and Wellness. My name is Drezelo, and I'll be your host today. Today we're going to be focusing on exercise and weight management, topics like how to go about exercising, dieting, health conditions that are related to both weight and or exercising, and some other areas. We're really lucky today to have with us two local doctors, Dr. Raymond Carrelle and Dr. Katherine Stam from We Care Weight and Exercise Management in Latham, right here local. So welcome to you both. It was really great to have both of you here, and thank you for taking your time out on Friday before Labor Day to be with us here. All right, so pretty much we'll start with some health and some exercise related questions. So how if someone were interested in weight loss, how does it really affect their overall health if you wanted to start an exercise program? Like what would some of the benefits you would see out of reducing your weight generally?
With as little as 3% weight loss, we will see a decrease in the risk of diabetes. 5% decrease is going to decrease your blood pressure, improve your cholesterol, improve your blood pressure. And 10% actually will decrease many mortality risks from diabetes, from obesity itself, and from obesity-related cancers.
Okay. Dr. Carrelle, anything?
Yeah, I mean, the way I look at weight loss is often I divide it into kind of two main categories, what I would call metabolic issues and then physical conditions of just having too much weight. So a lot of the metabolic issues, like Dr. Stam was saying, and related to diabetes and high blood pressure and high cholesterol, lowering those risks then in turn lowers your risk for heart disease and stroke, kidney disease. But then also the physical standpoint of having excessive weight, it can help improve sleep apnea if patients have that. It can help reduce low back pain, joint issues of the hips, knees, ankles, feet. People who deal with a lot of leg swelling problems, all these things can be linked in with weight, and reducing weight will help either improve them or maybe even prevent them.
Right.
Yeah, it also actually may improve self-esteem and depression issues.
So there's a lot of psychological type issues it's really beneficial for.
Yeah.
So, okay. How does someone know how much weight they should lose in order to how would someone know how would you establish a goal, I guess, for weight loss, depending on where you're at? Like, how would you go about that?
I think it really varies from person to person in terms of what their true goal weight is, because what we find in our program is, people's goal weights may not be exactly what, from a medical side, we're looking to achieve. Some people have the idea of being at their high school weight or being at their ideal body weight. And while those are noble goals, they may not always be achievable goals. So we always start with saying we want to have a realistic goal. So what is something that we think patients will be able to achieve? Because if they set a goal that's too much and then they don't achieve it, they get frustrated. They often will stop their attempts. They give up. But to start with, we often set a goal of at least 5 to 10% weight loss. And that's because of all the medical improvement we see with just that amount. And then, so I would say you want small increments and start with a 5 to 10% goal to achieve. If you achieve that and you want to go further, then by all means, go ahead and do that. You want to basically get to a weight that you're healthier, that you can maintain long term, because people can lose significant amounts of weight, but then they do the yo-yo dieting, and that doesn't really work good long term. So we want them to have a realistic goal that's going to make them feel better about themselves, but also that's something they're going to maintain. But if you're looking for just a basic goal to start with, 5 to 10% body weight loss, I think, is a good goal. Would you agree with that?
I would, absolutely.
Yeah. How does someone know whether they're in shape, whether they're basically healthy enough to even start a program, either on their own or in a medically supervised type program? Like, how does someone determine that, or is that something?
For diet or for exercise?
For exercise.
For exercise. Most people actually can exercise at a low intensity. A low intensity would be walking on the treadmill at 2 miles an hour, or walking where you're able to sing or carry on a fast conversation. Individuals that have any symptoms such as chest pain, pressure, palpitations, dizziness, injuries, joint pain, those people should probably keep their exercise at a low intensity until they're evaluated by their physician. People who don't have those issues, and who also don't have any chronic medical conditions, such as heart disease, hypertension, diabetes, they should see their physician before progressing on to moderate intensity. Okay. Did that make sense?
Yeah, I mean, I really think it does depend on the medical condition the person has. I mean, pretty much anyone can do a low-intensity exercise.
So just general walking.
General walking at a leisurely pace. Anyone can really do that. But if you're looking to advance your exercise beyond that to something more moderate or vigorous, and by moderate, we're talking about you can carry on a conversation, but you feel maybe a little winded when you're doing it. Vigorous is, you're having trouble even speaking. So, an example of maybe a moderate exercise would be, running or jogging. A vigorous exercise could be something like a spin class or a high-intensity aerobic class. So if you have a medical condition or certain medications, you probably want at least to talk to your doctor before you go to that level of intensity, or be in some sort of a supervised program. Either a program like ours or working with a personal trainer or somebody who has the experience to know when are you able to really make that leap to the next level of intensity. But just a simple walking exercise program anyone can do.
Pretty much.
I would caution, though, if you have any concerning symptoms, you should stop your exercise and see
completely,
your physician.
basically, even walking.
Even walking, if you're having chest pain, pressure, shortness of breath that's lasting more than 5 minutes, dizziness, passing out, anything like that.
The out of breath test is great. That one's very down to earth. Is it better to exercise in more short bursts, like more intense type exercise, or is it better to do something more longer term but slower, like from a weight loss and from a general health perspective? Is there any difference? Or does there not really make much?
There is a bit of a difference. If your goal is for fat burning, actually doing a moderate, so a lower intensity exercise for a longer period of time, you will burn more fat. However, if you are not restricting your calories, you're probably not going to lose weight. So it's restricting your calories and doing the slower, long bouts of exercise. High-intensity exercise, you're going to burn more calories, but you also have to be in shape to do that. I wouldn't jump right into it. There's also something called interval training, which is a mix of moderate and high intensity. So it's short bursts of high-intensity exercise, 30 to 60 seconds, followed by 3 to 4 minutes of moderate intensity. And that shortens your exercise time, but it does have greater benefits for endurance, fat burning, and calorie burning.
Anything?
I would say it's, and while you can get into very specifics about what's the best way to exercise and all that, I think the important thing is also realizing you want to do something that you enjoy, so that you're going to stay with it. Okay, if you're like, well, I hate to bike, then you're not going to go on, you're not going to bike.
Right.
I hate lifting weights. Well, then probably going and working out in the gym with weights is not going to be what you do. So you want to find something that you enjoy. I think time constraints really plays a big role with the decision also on, do you do short bursts or longer? I mean, people who are constrained by time because of work and family and are able to do a more moderate or high intensity, then they may be able to do that and do a 20-minute workout.
Right.
Someone who has more time and doesn't really have the ability because of their health conditions or maybe just their weight itself, they may be better suited to do a lower intensity, longer workout. So I think everyone has to kind of find what works best for them, something they enjoy doing to stick with it. And then those people that really want to get more into the real serious science of what is the better way to train, then you can talk about interval training and that sort of thing.
When just getting back to actually a point you made before, when someone does experience like lightheadedness or really serious out of breath, like what does that actually indicate? Is there any underlying problems, or is anything specific, or is it just a precaution? Like does that mean when someone has some of those conditions or symptoms?
Well, it can. There's a lot of different reasons that can happen. Some may be not as serious, and others can be very serious. For example, just being dehydrated. If somebody is not drinking enough water, either during the course of their day or during their workout, they can get low blood pressure, and that could make them get lightheaded or possibly even pass out if they're exercising too intensely. If they haven't eaten. So, because a lot of people who are trying to lose weight think that if they skip a meal or they don't eat as much, then they're going to lose weight, and that may in fact not be true. And so therefore they're getting the same problem, either getting a low sugar or they're getting low blood pressure.
Right.
They may take medicine that actually can lower their blood pressure. So lightheadedness, typically you're thinking of a change in blood pressure is occurring.
Okay.
But because it could also be something like a heart rhythm problem, a heart disease problem, you don't want to ignore it. So if anyone's having that kind of symptom, you always want to discuss that with your doctor.
Right. Is there any medical conditions that you can say right off the bat that people definitely need to check with someone before they start anything, whether it's walking or it's anything more serious? Is there anything right off that you'd recommend automatically just seeing a doctor first before you start something? Or are they more related to age, or how do you see it?
I think anyone who has a heart disease
Right.
condition, meaning they've had a heart attack, they've been told they have coronary artery disease, especially if they're on a lot of medications, they should always clear with their physician, either their primary doctor or their cardiologist first before doing, like I said, anyone can probably do a low intensity, but if you're trying to do more than that, you probably need to clear yourself first. People who have had strokes, so they may have some disabilities, making it possibly a little dangerous for them to do certain types of exercise or use certain types of equipment.
Right.
People who have asthma or COPD, because a lot of times they may get more out of breath during the activity. They may need to have an inhaler that they use before they exercise. So definitely any significant cardiac or lung condition, or if they've had a stroke, probably are good reasons to clear yourself with a cardiologist or primary doctor first.
Right. Okay.
I would add diabetes to that, just especially if you're on a medication that might lower your blood sugar.
Okay.
You are going to want the advice of a physician, and also diabetes significantly increases your cardiac risk. So again, you'd want to see your physician prior to starting an exercise program.
And you may not always have the classic symptoms with diabetes.
Right.
You might not have the crushing chest pain. It may be a weird symptom of, well, my neck hurt or my shoulder hurt, and you never made the association with, oh, that could be my heart. And it is more common in patients who are diabetic.
Okay.
Yeah.
You had mentioned COPD or something, and what exactly is that referred to?
Oh, I'm sorry, chronic obstructive pulmonary disease, which more people may know of as emphysema.
Okay.
People, it's usually from people who have been smokers, although some people have had long-standing asthma or serious asthma problems can develop this chronic breathing difficulty.
Okay. some people want to exercise just solely because of weight loss, not necessarily the best reason for doing something. They have an event that they want to lose weight for, and again, it's better to have a longer-term perspective. But if someone doesn't notice weight loss or significant weight loss, or not the weight loss that they're looking to get, should they just continue? I mean, what are the benefits basically to exercise outside of just simple weight loss? Why would someone want to continue if they weren't losing the weight that they necessarily?
I would say, to start off, it is very difficult to lose weight with just exercise alone. You would have to be at the gym doing vigorous intensity exercise for hours a day. And another example is, a calorie is about 3,500, or a pound is about 3,500 calories. If you walk or jog a mile, depending on individual differences, you may burn about 100 calories on that mile. So that's 35 miles for 1 pound that you would be walking or jogging. So, most of weight loss is coming from dietary changes, probably 80% of it, and then 20% of it from exercise. The benefits with exercise are across the board. Exercise improves your mood. It releases feel-good hormones in your brain. It helps with mobility, with arthritis. It decreases your blood sugars, your blood pressure. It improves your breathing.
Also, people who do weight-bearing exercises, it helps to reduce risk of osteoporosis and bone loss, so risk of fractures. And especially for seniors who often may have some balance issues, strengthening the muscle groups and regular exercise can improve balance, reduce risk of fall and injury. So it doesn't matter what age group you are, there's always some benefit of exercise that you can achieve, even if you're not losing the weight.
Right. Okay. So there's no excuses for anyone.
No. And the other thing I would also mention too is that a lot of people don't realize that when they're going through this, muscle weighs more than fat. So they may be building muscle and not seeing the change in pounds.
Right.
But their body composition is actually changing. So they're seeing a decrease in their waist circumference. So they actually are improving their health, even though their pounds don't look like they're coming off. They are still getting a health benefit.
Okay. Yeah. That's a really good point.
And that also brings up, BMI. People look at their BMI as, am I overweight or am I obese? And it's kind of misleading. I know Dr. Carrelle uses the example of Arnold, as if we used his BMI, he would be obese. But you really have to look at your body composition and percent body fat. It's a better way of looking at your overall health.
Percent body fat.
Percent body fat.
Okay.
Yep.
Is there any way someone can get a rough estimate of that? Or do you have to, is there more involved with it? You really have to see a doctor to get any idea of where you're at? Or
no, there are many ways you can figure out your percent body fat. A lot of personal trainers will do it with skin fold calipers. A lot of actually, there are many scales that are available now that work by bioelectroimpedance, which sends a little electrical current through your body. And that will give you an idea of your percent body fat, water, and muscle mass.
Okay. But I would just be cautious that if you have a pacemaker or any other implanted electrical device of some type, we don't want you should not use one of those devices because of the electrical current. So we have these devices in our office, and we do not put patients with those conditions on those songs.
Another thing I just thought of, a simple thing you could do at home is just measuring your waist circumference. So women should have a waist circumference under 35 inches and men under 40 inches. And that's going to give you an idea of central adiposity or central weight gain, which is the dangerous area to carry weight.
And waist circumference is at your belly button, not beneath your waist. Because a lot of people will go by their pant size, but unfortunately the belly is hanging over. That's not really your waist circumference.
Yeah, I would have to say that's mostly men that would do that.
All right, we kind of touched on it, but there's really 4 types of exercise: more endurance oriented, more strength oriented, more balance and flexibility. Is there any amount of time you should spend in each area, or do you have any recommendations for the people wanting to touch on one or all 4 of those?
Well, yeah, I mean, I think just to kind of go through each of those, so what do we mean by endurance? That's more like aerobic exercise. So increasing your heart rate, increasing your breathing. And these offer a lot of benefits from just the cardiovascular standpoint. So heart health, lung health. Examples of that are like jogging and running, walking at a brisk pace. Then we get to strength, and strength is just making your muscles stronger. Okay, these are going to be things like weightlifting, using resistance bands, or even simple calisthenics, push-ups, sit-ups, squats. So you don't need a lot of equipment to do simple strength testing, strength training. Balance is more of like thinking of stability, just ability to control yourself so you don't fall or have, and this may be a little more commonly seen, again, in seniors who may have some balance problems. So things as simple as standing on one foot, walking heel to toe. You can do even more sophisticated things like Tai Chi, or even the forms of yoga that really are balance. And then we would do flexibility, and flexibility is more about stretching, of the muscles, improving range of motion of muscles and joints, helps to reduce risk of injury. And these sorts of stretching, can be seen in exercises like yoga or just simple stretching. And a lot of people don't know actually the proper way to stretch. We're taught, kind of in high school gym class, the bouncing stretch where you just kind of, a stretch should be about a 20 to 30 second maintained position of stretch where you feel some kind of pulling in your muscle. It shouldn't hurt, but you should feel a pulling in your muscle. And I think all four aspects are very important for a really well-balanced exercise program. Unfortunately, some people kind of focus just on one area, and I see this a lot. People are like, "Well, I run." Okay, good. So you do a cardiovascular exercise. You're doing that, but do you do strength training? Do you do stretching? And we try to get people to understand that they really want to do all of those four things to really have a well-balanced exercise program. The good thing is some of these exercises actually can be found in the same thing. Like yoga can be found in strength, flexibility, and balance. So you can get the same thing in all three areas in one exercise. So you don't have to do four different exercises. You can do one exercise that covers a lot of those different areas. I mean, would you agree with it?
Yeah, I would absolutely agree. And it also depends on what your goals are. If your goals are for toning, or if your goals are for weight loss, you may mix up your exercise a little bit differently. So as far as balance, it depends on what like personal training organization you're going with, but many of them will recommend doing 10 minutes during your daily workout of balance. And others say if you have problems with your balance, you should be doing 10 minutes 3 times a week, and seniors definitely 10 minutes 3 times a week. But if you are looking to build muscle and you don't have any weight to lose, you're probably going to focus more on strength training rather than your cardio. But definitely, it's important for doing all of these. So cardio is going to improve your blood pressure, heart, lungs function. It helps with insulin sensitivity, so it can decrease your blood sugars. It helps with stress. It helps you sleep. It, like I said, it releases endorphins and feel-good hormones. Resistance training, a lot of women don't do because they don't want to get big and bulky. And also, you're not sweating a lot normally, and frequently women will not think that they're doing anything as far as calorie burning. And but it works to increase your muscle mass, which is what drives our metabolism. And you also burn calories for 2 days after you do resistance training, so it's definitely worthwhile doing. And then stretching, I just wanted to add one thing, is you should always stretch a warm muscle rather than a cold muscle. You want your muscle to be nice and pliable. If you stretch a cold muscle, you're more likely to injure yourself.
We always use the analogy, if you take a rubber band and you put it in the refrigerator or freezer, take out a cold rubber band and stretch it, what happens? It snaps. Take a warm rubber band, it stretches.
So the people that you see at your facility in the medical, specifically the medical supervised weight loss and dieting, are more people with some of the pre-existing conditions that we talked about before. Chronic heart disease, diabetes, possibly stroke victims. Is that pretty much
We actually see a wide range. We probably see patients definitely who have a lot of chronic health conditions, but we also see the patients that are dealing with significant weight problems that haven't developed some of those conditions yet, but they're looking to not hopefully get to that point. So we do see a variety. We do see patients that haven't developed them yet, and that's our goal, so they don't develop them. But yes, there are a lot of chronic health conditions like you just listed there that we deal with, in addition to a host of other things. A lot of what we deal with also is psychological. We deal with a lot of depression and anxiety issues in patients, a lot of what we would refer to as atypical eating conditions, because unfortunately most patients who are struggling with their weight, they probably haven't gotten to that point just because they eat too much.
Right.
For a nutritional standpoint, they may be eating the wrong things or eating too much of something, but it's not because they're hungry, it's because they are eating for other reasons, whether it be because they're using it for comfort, they're using it because it's a stress reliever for them,
right.
They're using it for all these other means, and so we do deal with a lot of those aspects of behavior that really factor in.
Okay, that's a good point. That's really a segue. We're going to be touching on dieting now. What type of diet, when someone begins an exercise program, what type of dieting should someone actually, what type of diet ideally should someone be on? There's a lot of fads out there, and there's a lot of diets that are for temporary weight loss. I mean, longer term, what does an ideal diet look like, whether you're on an exercise program or not, actually?
I would say for a healthy lifestyle, you should work on cutting out any sweetened beverages, so you're not drinking your calories, staying away from processed foods, and eating more whole foods, fruits, vegetables, whole grains, and lean proteins.
Right.
I wouldn't start an exercise program if you were doing something that would be what we call a VLCD, or a very low calorie diet, which would be under 1,000 calories. You wouldn't want to start exercising if you were doing something like that. So you want to eat sensibly with a good balance of protein, fats, and carbohydrates.
Okay.
Yeah, I think in general, if you sum up what we probably do mostly in our clinic, is probably low sugar, low carbohydrate, higher protein diets. So I think that's what the science and the literatures are showing now is really the way to go in terms of how to really benefit patients with their weight loss, improve their metabolic conditions. So I would say that. And then for people who are really trying to bulk up the muscle, like you mentioned earlier, then they really want to make sure they're having adequate protein.
Okay. Is there anything, if someone has a pre-existing condition, is there any type of diet that person should be on if you do begin an exercise program, or generally? Is there anything that should be emphasized if you have some kind of a condition that might?
Yeah, there are definitely certain health problems that you are going to determine maybe what type of diet plan you'd want to do. In general, patients who are who are diabetic or what we call pre-diabetic, we're probably looking at more of a low sugar, low carbohydrate diet, because that's underlying most of their problem is their ability to handle sugar.
Right.
Patients who have something called celiac disease, which is a gluten sensitivity. You hear a lot about this now about gluten-free diets, gluten-free products. So we're going to look more at a gluten-free type of diet for them. Someone who has chronic kidney disease, you have to be very careful about the amount of protein in their diet or the amount of potassium in their diet. So there are some health conditions that will really determine maybe what plan you're going to go with. But for most people who are in generally good health, probably a low sugar, low carbohydrate diet.
Pretty much does it.
Yeah.
At your facility, when people come to you for supervised weight loss or weight management, is that typically covered by insurance, or are they paying out of pocket? Like, how does that usually work? And I know that's part of that's based on whether they have a pre-existing condition, a major, serious pre-existing condition or not. But how does insurance work when you begin a supervised medical program exercise? It's somewhat unique. We're sort of a unique program. There aren't a lot of programs like ours around. A lot of the
programs that are out there right now are probably prepping patients for bariatric surgery, so for the surgical aspects, or they are out of pocket paying for just that specific program. We are covered under insurance plans. Right now, the majority of the insurance plans make us only be open to the patients within community care physicians, which is our larger organization.
Okay.
There are a few that will allow us to see patients maybe outside of that. And it does depend on the insurance plan, because some insurances don't cover obesity treatment or weight loss management or nutritional management. It's just the nature of the plan that a person has. So it does vary. In general, for the patients in our program to qualify, they either have to have a BMI above 30, which is by definition what is called obesity. If they have a BMI above 30, then they qualify for our program. If they have a BMI under 30, generally anywhere from 20, just to kind of classify, BMI under 25 is 18 to 25 is considered normal weight. 26 to 30 is considered overweight, and above 30 is considered obesity. So if you have a BMI between 26 and 30 plus at least one medical condition related to your weight, high blood pressure, high cholesterol, diabetes, back pain, joint pain, that also would qualify a patient. So most people who have weight issues probably have something in that realm that we're dealing with. So it's not very common that we come across someone who absolutely cannot qualify for the program unless they have a normal weight to begin with.
Right.
There are also different ways to classify obesity. So you could use the BMI, like I was saying, like we've been talking about, but you can also use percent body fat. You can use waist circumference. You can use waist to hip ratio. So usually we can get someone to qualify for the program.
Okay. In this field, generally speaking, what changes have you seen over the past 10 maybe years, at least recently anyway, and what would you like to see like 10 years out, or what do you think is going to change? What are we on the edge of, or somewhat in the next?
Well, actually last year the AMA recognized obesity as a disease, and hopefully that will prompt physicians to address that at appointments and also help with coverage issues, because as Dr. Carrelle said, not all insurance companies are covering nutrition or obesity counseling or weight loss medications. So that was a huge step in the past year.
I think we're seeing more people actually going into this field, what we call bariatrics. That's the field of what we're talking about with weight loss management. So I think we're seeing more people who are actually going into the field now and doing this either full-time or part-time with their already existing clinics. So I think we're seeing a growing interest in people pursuing that. And I think that's really reflective of what we're seeing in the population of this incredible rise in weight gain and the problems related to that. I think going forward within the next 10 years, it's hard to predict what will happen. And the thing that I hope will happen is that all insurance plans will cover our type of clinic. And because I think it's going to be a real important part of healthcare going forward. There's a lot of things that are going on in medicine right now that are related to chronic disease, about so treating diabetes and heart disease and high blood pressure, and trying to do it more cost effectively and more efficiently. And that's great, and that needs to be done absolutely. The problem is we're not addressing the preventative side of things as well as I think we need to be. And while we're doing good to try to make all the people who have these conditions better, I don't know that we're doing enough to prevent the people from developing the problem. So yes, we control cost and everything on it, but the growth of that population continues to grow, so the costs are going to go up. So I would really like to see more monies and things put forward that allow people to come to clinics like ours to do these things and to prevent them from getting these problems that are developing. Why
is there such an increase in obesity and people's weight generally? It seems over the past like 20 years, is the food is more high fat content? Are people in more office type settings where they're sitting down more for their jobs? Why does it seem to be more of a problem now than it was in the past?
There are multiple reasons. One is, we're all chronically busy and on the go. We're looking for convenience foods. And most of the convenience foods are high in carbohydrate, high in trans fats, saturated fats. Also, we are more sedentary.
Right.
We are under more stress, and stress actually will increase our cortisol levels and can make us more insulin resistant, which leads to further weight gain. There are some experts that feel that some of these processed carbohydrates and concentrated sweets may actually be addictive and trigger the reward center in our brains and make us feel good. We want more and more of them.
Yep.
We crave them. We develop a tolerance for them. What else?
Well, I think even the quality of the food that we have is nutritionally gone down. So not only are the foods that a lot of people are eating already poorly valued in nutrition, even the fresh fruits and vegetables we're eating also probably don't have the same nutritional value they once did because of the quality of the soil that they're being grown in. So I think we have two problems there, poor nutritional foods and then the choice of foods that are such high in sugar and carbohydrates. You mentioned fat. Actually, fat is not probably the problem. And that goes against probably a lot of what people were brought up thinking. If you go back in the 70s and 80s, that's where the low-fat diet really took off. And it came out so after some articles, I believe it was in Time magazine, did an article on fat and how it was linked to heart disease. So everyone went low-fat. Low-fat was the answer. And unfortunately, when you take fat out of a food, it often was replaced with sugar or carbohydrate. And the sugar may have come in various names, but it wasn't. It was sugar. And if you look at the CDC trends of obesity, which you can go online and they'll show you, starting then, the obesity trends in this country took off. And it correlates very well with the change to low-fat diet. So that's why we say our program is more low-carb, low-sugar. We didn't say low-fat. It's low-carb and low-sugar. Now, there are some fats you want to avoid, trans fats. Those are the things you'll find in the Twinkies and those sort of things. But there are a lot of healthy fats that are very good for you and will help you with weight loss because they reduce the spike of insulin that promotes weight gain with sugar. So I think that is a big change for a lot of people. And unfortunately, even a lot of doctors don't know that, and because I hear them say, "Oh, my doctor told me to go on a low-fat diet," and we kind of cringe a bit because we're like, "No, you're not going to lose weight that way. We really got to rethink that." So there's a lot of education that needs to be done, I think, to get people past that idea of low-fat. Because when they go to the grocery store, they see low-fat on the label. Oh, that must be healthy. And I tell people, if you see low-fat on a label, run, avoid it, because it is probably not good for you. The other things that I think have really played a role with the change that's happened is also the economic issues. It costs money to eat healthy. I mean, fresh fruits and vegetables and produce, they cost money. It's cheaper to buy something packaged and processed. You can buy it in bulk. So people who are strapped from an income standpoint, really, I can understand that. But it may not be as much that as we think, because from an economic standpoint, the U.S. only spends about 6 to 7% of its household income on food. We are one of the lowest of all developed nations in terms of how much money we spend on food. The next after us is the UK at about 9%. So we're spending our money, but it's just not on food. We're spending it on a lot of other things. So when you say, what would I like to see happen in the next 10 years? I'd like to see people, or some sort of a big push educational-wise about the importance of eating well and eating proper nutrition, and that we don't necessarily need the latest cell phone when we can go and, spend some money on some fruits and vegetables and eat healthier. So I think it's also partly our society, and what are we deeming important and what are we not deeming important. And I think we need to change our focus on what's important back to healthy living, eating well, and exercising.
And prevention. Yeah.
And prevention, yeah.
Generally.
Yeah.
You had mentioned weight loss drugs. Is there do you have any more information on that? When should they be used? Are they, how good are they? I haven't really heard much about those.
Sure. Yeah, they have received a bad name in medicine, but there are a few that we use that have been around for 50 years and have a proven safety record. There are people that would not qualify for them. It depends on your health conditions, really. But they do work short term. We use them. Some people have to be on them longer term, depending on their metabolic makeup and their behavioral issues.
Right.
I think it's important to realize it's not just for people who are lazy. I think there's this idea that I'll just take. People are lazy, so they're just going to take a pill. We typically don't start people on medication right off the bat. We will really work more on education and nutrition and meal planning and understanding how to eat properly, because we know that ultimately long term you have to change your lifestyle. Because I even hate to use the word diet as our program. It's not a diet program. We're talking about more of a lifestyle and wellness program, because diets are the idea of I'm going to do it for a short time and then I go back to what I normally do. Yeah. This is more lifestyle change. But if people are making all the right things, it's like I am exercising, I am eating well, and I'm still not losing weight. What is going on? That is somebody who may be a real good candidate for these medications to help push them through that difficult plateauing phase where they're not losing and they're ready to give up or move on. The other thing, too, is a lot of people have a low metabolism and don't know that.
Just naturally. Yeah.
They naturally have a low metabolism. They're not making it up. They actually do have a low metabolism, and we test for that in these patients with a very simple device we use that can tell us, are they actually below normal metabolism? And then we try to look for the reasons for that, or how can we improve it. But in those patients, they can really benefit from these medications to help them. And for some people, it's short term. Some people maybe longer term. The fact that we're now thinking of obesity as a chronic disease. I always say, well, I'm not going to treat your blood pressure with a medicine for 2 months and then take it away from you. Right. So why would I do the same with a weight loss medicine if it's helping you? There's a lot of different types and classes of weight loss medicines. Some of them are appetite suppressants. Some of them are medicines that are used sort of off-label. They're for other purposes, but they do also assist with weight loss. There's some antidepressants that are used in that way. There's something called Wellbutrin. There's something called Topamax, which actually is a neurologic medicine that actually is also approved now for weight loss. A lot of people have probably heard about Xenical, because that was available over the counter. We don't tend to use a lot of that because that just makes people not absorb fat and usually just gives them loose diarrhea. So we try to avoid that one. But there are some select ones that really can be very helpful. Yeah.
Okay. And just one last item. Why did you both get into? Why did you pick exercise and weight management, at least as part of your career? What made you both wanted to get into this field specifically when you could have done just about anything, probably?
Sure. Well, I started out in family practice. I was practicing for 15 years, and I was seeing this growing obesity trend, and was seeing patient frustration as well as my own, with increasing number of medical problems, complex medical problems, and in medication lists that were just a page long. And it's also the side effects with the medications, the cost of the medications, and realizing that a lot of these things could be treated or prevented with lifestyle. And I didn't feel that I had the knowledge or the time in family practice to devote to that. So I, started studying bariatric or weight loss medicine, which then led to fitness, which led to some functional medicine, some meditation, some yoga, and so I'm happy to say that I feel like I can approach a patient now holistically and help them improve their lives, help them live their lives more fully.
we're married, so she started this process first. I am a family physician, so I was still doing the traditional family practice. And it was only after she really started to move forward in her career that she's like, I really want to do this
Right.
as my career, that I started taking really more of a look and interest in this.
Right.
And it's really invigorated me, because I was really getting somewhat burnt out and frustrated from my typical practice of, all right, here's another pill, here's another pill for you, let me give you another pill. I didn't have the time or the knowledge
Right.
to really counsel somebody on, well, here's what we want to do to get you off your pills. And I really started learning a lot from her, and that's really brought me on board and making my own journey from my standpoint. I've lost probably over 25 pounds in the last 2 years, and it was all since this started.
Mm-hmm.
I started practicing what I preach, and
Right.
I started doing it, and I started feeling better.
Mm-hmm.
I started exercising more. I actually came off some of my own medication I was taking. So I think it was a personal journey as well as a professional journey for me, and now I love it. And I still do practice part-time family practice, so I still
Right.
do my primary care.
Right.
And I do this also part-time, and it's become a nice balance for me, because I'm able now to approach from both aspects and take back what I'm learning in our weight clinic to my other practice, and instill in patients that knowledge, and know that now I kind of know what I'm talking about now,
Right.
whereas before I didn't. It's not taught in medical school.
Right.
This is not taught in residency.
Right.
And unfortunately, it probably should be. And getting back to that, what do I hope in the next 10 years?
Right.
I hope this becomes a base for a lot of the teaching that is now put out there for our medical students
cool.
and residencies, is that, this is a foundation for the future of treating people. And it's kind of interesting that we're probably going full circle.
Yeah.
We're probably going back to,
Simplicity.
this is what it was before pills
Yeah.
were available.
Right.
And, we got so dependent on pills, but now it's like, well, maybe we got to go back to what we were doing earlier. And, so that's why I'm really have gone this route.
All right. Well, I think we've pretty much covered as much as we can during our time here. I think we provide a lot of great information on exercise and weight management. I really, really want to thank Dr. Stam and Dr. Carrelle for taking the time to appear today with us. And I want to thank you for watching, and I hope you tune in next time for our next edition of Health and Wellness.